Hello, sir. A very warm welcome for today's podcast. And sir, could you please give your brief introduction, then can proceed ahead?
I am Dr. Pawan Kumar Singh, Vice Chairman, Haemato-Oncology and Bone Marrow Transplant at Sharda Care Healthcity, Greater Noida, Delhi NCR region.
Thank you so much, sir. So the first question for today is, so let's start the very beginning. For someone who has just received a diagnosis of a sickle cell anemia and has no medical background whatsoever, how could you explain what sickle cell anemia actually is in the simplest, most relatable way possible?
Basically, if we see the pathology of the disease, sickle cell anemia, what happens? Normally, our red blood cells are disc shaped, but in sickle cell disease, what happens? They, because of abnormal hemoglobin, which is because of genetic mutation, the red cells, instead of disc shaped, they become sickle shaped, and this sickling of red cells, it basically clogs the small blood vessels, and that is the why the patient is having all the symptoms related to. So because of these clogging of vessels and capillaries, the patient can have pain, means pain crisis, sometimes acute chest syndrome, stroke, means thrombosis or clotting in major vessels also. These are the complications. From head to toe, almost any organ can be affected by sickle cell disease.
All right, sir. So the next question is, how common is sickle cell anemia globally and which populations and region are most affected? Like, are we seeing more cases being diagnosed today than before? And if so, is that because the disease is increasing or because our ability to diagnose it has improved?
And basically, it cannot be said that because of that the numbers are increasing. It's mainly because of the population size, because the population is increasing, so is the number is increasing. There are some endemic areas where sickle cell disease is quite common, and these are mainly malaria endemic region. So because these sickle cells and the patient, they have survival advantage, so that's why the disease becomes more prominent. If you ask me, the highest number of cases or the prevalence, it is seen in Nigeria. So basically in central and eastern part of Africa, and plus sporadic cases somewhere in India also. We see central in the tropical areas, Odisha, where sickle cells are more commonly seen, and highest incidence is in Nigeria, then DRC, then other areas there also it is quite common.
So let's talk about like what is actually happening inside the body. Like in a very simple term, what goes wrong at a cellular level in sickle cell anemia? What does the red blood cell change in its shape, and what does the sickle shape actually means for the patient's body?
As I said, the normal shape of red cells is disc shaped, and when the because of the disease, because of this mutation, the sickle cell disease, the red cells becomes sickle shape. So this abnormality in shape, that basically clogs the vessel. So when it blocks the vessel, it can lead to all these symptoms like pain crisis, sometimes sequestration crisis, then strokes, and clogging of major blood vessels. These are the symptoms which can happen with this abnormal sickle shaped red blood cells. Now there are other factors like it depends on environmental factors also. Like African sicklers, they are more symptomatic, and more number of patients require bone marrow transplant to cure the disease. But Indian sicklers, if you see, they are less symptomatic, and they usually don't require these high-end treatments like bone marrow transplant to cure the disease. So environmental factors also play. So that is why it is always recommended for these sickle patients to maintain good hydration, avoid extremes of temperature like extreme cold or extreme heat exposure. This can also lead to sickling crisis. Sometimes some infections, these are also risk factors which can lead to increased sickling episodes. Then hypoxia, so where the oxygen level is low. So these are the areas, these are other environmental factors which has major role in the sickling crisis.
So one thing that like confuses many patients and families is the difference between being a sickle cell carrier or having a sickle cell trait versus actually having a sickle cell disease. So can you clearly explain the difference, what it means for the patient and the family?
Basically, for any protein like hemoglobin, so it's a defect of hemoglobin. So hemoglobin is a type of protein which and its normal role is to transport oxygen and deliver it to the body. Every protein is formed by a gene. So gene, we have for any protein we have usually two genes. So if one gene is affected, so that is called as trait, sickle cell trait or carrier. But if both the genes are affected, so this can lead to sickle cell disease or sickle cell anemia. Or simply what we can see, that the type of hemoglobin, so normal hemoglobin is HbA, and sickle hemoglobin is HbS. So sometimes in the reports they see the terminology like SS or AS. So AS carrier or sickle trait is same thing, and sickle cell disease or sickle cell anemia is SS, which means both the genes of hemoglobin are sickle. So they are having defect which is causing the sickling of red cells. So SS means homozygous or the disease, and AS is heterozygous trait carrier. We can call it any term.
So, sickle cell anemia is a genetic disease, like it is passed from parents to children. So, can you
Yes.
explain how this inheritance works and what is the chance for a child inheriting the disease if one or both parents, carry the gene?
Like we inherit, we for any protein, as I said, we have two genes. We inherit one gene from father and one from the mother. If suppose out of the parents, if one parent is carrier, then the child can maximum be carrier, then there is no problem. The problem comes when both the parents are carrier. There will be 25% chance in each pregnancy that the child can have SS or the sickle cell disease, which is a problem. Whenever it is there, if family history is there, they have to do, and first thing is that they should know their carrier status. This is very important. So any couple who is planning for pregnancy, they should know especially those who are living in sickle endemic areas. So there we should know our carrier status, and if we are carrier, then we have to be cautious, and because in every pregnancy there will be 25% risk of sickle cell disease, which is a big problem.
So, what are the earliest signs and symptoms of a sickle cell anemia that parents should watch for in a newborn or young child? Like, at what age does the disease typically begin to show itself?
See again, if the symptoms can be, we can start seeing the symptoms when the child is around 5 or 6 months, because before that it is basically mainly the hemoglobin is fetal hemoglobin. So that usually takes care of, that is usually is not affected by all these factors, and their hemoglobin is normal. So once there is after 6 months, these hemoglobin F, that is fetal hemoglobin, it changes to the normal hemoglobin. So in case of sickle cell, this will be changing to the fetal hemoglobin changes to sickle hemoglobin. And after 5 to 6 months, we can start seeing the symptoms like child is crying, failure to thrive, not feeding, not taking feed properly. So these are sometimes they can have pale. So these are the symptoms we should be careful. And once these symptoms start to appear, then we have to treat them, and we have to evaluate and diagnose. Once the diagnosis is there, proper management with a hematologist is required. And we have to monitor these kids also, because not a newborn or a child who is diagnosed with the sickle cell disease require bone marrow transplant. So we have to watch at least for 1 to 2 years to see the symptoms, how symptomatic is the disease. For only very symptomatic disease, these high end treatments like bone marrow transplant is required.
Okay. So you talked about pain crisis or vaso-occlusive crisis, like one of the most feared experience for a sickle cell patient. So can you describe what is actually happening in the body during your crisis, what triggers it, and what a patient or a family should do when one begins?
So as I mentioned, some infections, hypoxic state, any stress, physical stress, dehydration, these are the things which can cause sickling crisis. And sometimes, diarrheal episodes, any these kind of episodes can lead to sickling crisis. So sickling crisis is basically a generalized pain in body, and it is such a severe pain that patients usually require opioid analgesics to control the pain, good hydration. So wherever possible for these children, we have to be careful and take care of all these things to prevent dehydration, hypoxic, any stress or any fever or anything. It has to be managed properly in hospital setting.
What are the basic tests that we can do, like for to confirm the sickle cell diagnosis? Like why early diagnosis is also very critical.
So first thing is that to know the disease, and it can be diagnosed very simple test. HPLC test is there, by which we can diagnose sickle cell disease based on the symptoms. Once it is diagnosed, then we have to be taking care of all the measures to prevent sickling episodes. Hydroxyurea is one drug which is very very important in preventing these painful crises. Plus maintaining good hydration, overall hygiene, health. These are again very important.
You talked about acute chest syndrome, like what it is, like why it is called, and I mean how it is treated.
So acute chest syndrome, basically it is clogging of these vessels in the lungs. So when these basically the vessels of lungs are get clogged by these abnormal sickle red cells, this causes acute chest syndrome. So it manifests as severe breathlessness, and the child is very breathless, hypoxia, And X-ray, if we see chest infiltrates on X-ray and saturation level drops. So these are very sick state in a sickle cell patient. So it has to be managed in hospital setting. Patient has to be admitted in ICU, and close monitoring is very important. And usually it is managed by hydroxyurea and steroids. Dexamethasone is very important. Plus, along with that, given IV antibiotics also to prevent secondary infections.
So we see that blood transfusion are frequently used in sickle cell management. When it is recommended, and what are the risks associated with it if we use it in a long term?
So basically, when we do transfusions in sickle cell, so for prevention of crisis or if the patient requires any surgical procedure, so then also we can transfuse the sickle. Basically, it is diluting the sickle cell percentage. So if the patient is symptomatic, usually they have HBS percentage more than 60%. So if we give normal blood to them, the percentage of sickle cell goes down and the symptom relief is usually seen. So these are the indications where, suppose if hemoglobin goes down or if the patient is planned for any surgical procedure or during the painful crisis or sequestration crisis, will be managed by blood transfusions.
So pain management is like a daily reality for many sickle patients. How do you approach pain management both during crisis in the hospital or for chronic pain at home? And how do you balance the need for effective pain relief with concerns around long-term opioid use?
So one thing is very important, that is hydroxyurea. So it basically prevents the painful episodes which are happening to a child or any adult. And for severe pain, usually once they try to control with the analgesics, normal non-steroidal NSAIDs. And if it is still not controlled, then opioid analgesics, so oral analgesics, opioid analgesics can be taken at home. And if it is still not controlled, then patient has to get admitted and to take parenteral, maybe IV or subcutaneous opioid analgesic to control the pain. Plus, along with that, we have to take care of the other things like hydration, maintaining good and hemoglobin also to maintain above 10.
So, doctor, there has been like extraordinary excitement recently about gene therapy for sickle cell anemia. So, can you explain what gene therapy actually is for the sickle cell patient?
So gene therapy is recently approved. So basically, it was approved, I think 23 or 24. 24 it was approved, and it is mainly for older patients, like more than 18 years of age. So where the patients are having very symptomatic for that. So there, the gene therapy. So gene therapy basically works on that. We collect the stem cells, and these stem cells, there the defective hemoglobin gene basically it is corrected. So there are two types of gene. One is the defect is corrected, and other one is the therapy where the HbF, the means promoter region of HbF. So basically, in that HbF is induced. The gene of HbF is induced by the gene therapy, and patient requires chemotherapy. So first chemotherapy is given. First the harvest cell patients, basically stem cells are harvested, then they are modified. The genetic change is required, genetic change is done, and then patient is given chemotherapy. After that, these modified stem cells are given back to the patient, and so that it starts for this. So recent, we have seen that this good data is coming out, and but again, long term it is very costly, and currently as of now it is not available in India. So mostly it is available in US or Europe.
All right. So, where do you see like sickle cell treatment in next 5, 10 years? Like, are there new researches going on? I mean,
So first thing is that, yes. So first thing is basically the most important thing first is to the do the prevention, means preventing the children to be born, and that is why it is very important by screening young couples for sickle cell carrier state and doing prenatal diagnosis in every pregnancy. The other thing is prevention of sickling crisis. For that, hydroxyurea, hydration, and other things are there, which are very important, has to be taken care of. Then there are some medications which are there which prevents sickling. So these are basically disease modifying therapies which are recommended. Like there are some injectables like crizanlizumab, voxelotor. Some drugs are available having good responses in preventing sickling crisis. Then after that is bone marrow transplant and gene therapy. So these are the two options by which we can cure sickle cell disease, and the child will be permanently cured and will not have any sickles. So these are the means treatment options are there which can which are required for the management of sickle cell disease.
So, what lifestyle changes, precautions, and daily habit can help a sickle cell patient reduce the frequency and severity of the crisis? Are there any specific triggers like cold, dehydration, stress, altitude that patient absolutely must avoid?
Yes, these are the important things which you have mentioned. Along with that, so basically hypoxia, stress, dehydration, and any febrile episodes, so infections. So these are important triggers which can lead to sickling crisis, and these are very important. So as far as we can prevent, it is important. So that's how we can prevent the number of sickling episodes. Along with that, taking hydroxyurea, because sometimes the episodes can be triggered spontaneously also.
So, like many young patient, basically young adults, like ask about the career choice, like physical activity, travel, and whether they can live a relatively normal life. So, what is your honest answer to them?
See, we cannot say whether absolutely normal life is possible for these patients, but yes, by taking all these precautions, taking daily hydroxyurea dose as prescribed, and carrying opioid and these analgesics with them. So these are the things which they can try. But still, there are some factors which can be means spontaneous sickling crisis can also be seen.
Like for a woman with a sickle cell anemia and who wants to have a children. So, what are the risks during pregnancy? What additional care do they need? And should they undergo genetic counseling before conceiving?
Yes, every patient, every couple, if both the couple are carriers, so there will be 25, as I said, 5% risk of sickle cell disease will be there in every pregnancy. So they have to be careful. So at to 10 weeks of pregnancy, they can do prenatal diagnosis. And by this, if suppose the developing fetus is having sickle cell, they can go for abortion. If not, they can continue with the pregnancy. So genetic counseling, yes, it is very important.
So now the final few questions. So the patient also ask, I live in a country where sickle cell treatment is very limited or very expensive. So is traveling to India for my treatment a realistic option? And what should I look for in choosing a specialist center abroad?
We see India, so a lot of centers are there, and we see a lot of patients traveling for medical tourism and for the treatment of sickle cell disease, including it's mainly bone marrow transplant, and sometimes for the management of complications like coming for hip replacement surgeries because they are at risk of AV and avascular necrosis of hip also. So these are other high-end treatments for which patients used to travel, basically to manage for they travel for the management of complications, and other is to cure the disease, and that is mainly bone marrow transplant. So yes, I can say that the quality of care what we have in India, especially related to bone marrow transplant, including haplo in sickle cell disease, it's there are many centers, good centers, and having very good outcomes. So this is quite possible, and they can plan to come. Any patients who are having and they are looking for option, they can definitely choose India as their treatment destination.
All right, so finally, how can patients or family watching today reach your team if they would like a consultation, a second opinion, or a guidance on treatment option, including new therapies?
So we are available. We have a dedicated team. International department is there, so who is taking care of providing help related to their travel, stay, and treatment. So at Sharda Care, our international team is there, so they usually take care of these. And plus, Hospidio is also there, so they can Google about and they can check about there, and they can raise their query, important questions if it is. So they can send all the details, and then we'll get back to them. So either Hospital team or Sharda Care team will get back to them, and they can answer their queries, and for their smooth treatment and travel, we can help them.
Thank you so much, sir, for giving your time and answering all the queries. Thank you once again, sir.
Thank you. Thank you.